Transthoracic Echocardiography for congenital cardiac anomalies, complete. Follow-up or limited study. Transducers are placed on the patient's chest to record an echocardiograph, which uses ultrasound to visualize the heart's function, blood flow, valves, and chambers. Echocardiography, transthoracic, real-time with image documentation, 2D, includes M-mode recording, when performed, complete, with spectral Doppler echocardiography, and with color flow Doppler echocardiography. Complete without spectral or color Doppler echocardiography. Follow-up or limited study. This is a non-invasive study that uses ultrasound to visualize the heart's function, blood flow, valves, and chambers. Two-dimensional echocardiography, also referred to as real-time imaging, is performed using multiple transducers or a rotating transducer, and these images are recorded on videotape. Computer reconstruction provides the two-dimensional image of specific planes of the heart. M-mode, when performed, provides additional detail of specific portions of the heart. A stationary ultrasound beam is directed at the area of the heart requiring additional study. Echocardiography, transesophageal, real-time with image documentation, 2D, with or without M-mode recording, including probe placement, image acquisition, interpretation, and report. Placement of transesophageal probe only. Image acquisition, interpretation, and report only. Transesophageal echocardiography for congenital cardiac anomalies, including probe placement, image acquisition, interpretation, and report. Placement of transesophageal probe only. Image acquisition, interpretation, and report only. Transesophageal echocardiography, T, is an invasive technique whereby the transducer is placed at the tip of an endoscope and introduced into the patient's esophagus to record a two-dimensional echocardiograph or as guidance for procedures performed on intracardiac or other great vessels and structures. This set of codes should be used for T used to diagnose cardiac sources of emboli, prosthetic heart valve malfunction, endocarditis, aortic dissection, cardiac tumors, and valvular heart disease excluding congenital heart disease. Echocardiography, transesophageal, T, for monitoring purposes, including probe placement, real-time two-dimensional image acquisition and interpretation leading to ongoing, continuous, assessment of, dynamically changing, cardiac pumping function and to therapeutic measures on an immediate time basis. T provides high-quality, real-time images of the beating heart and mediastinal structures. This code reports ongoing hemodynamic monitoring using T. T may be used to monitor critically ill patients in the intensive care unit as well as patients in certain operative settings. In both the intensive care unit and the operating room, it is used to monitor cardiac function including cardiac preload, contractility, and valve function in patients with acute hemodynamic decompensation. In addition, T may also be used to assess and monitor mediastinal, heart, lung, and aortic injury resulting from blunt chest trauma even in patients undergoing other life-saving procedures. Echocardiography, transthoracic, real-time with image documentation, 2D, includes M-mode recording, when performed, during rest and cardiovascular stress test using treadmill, bicycle exercise, and or pharmacologically induced stress, with interpretation and report. Including performance of continuous electrocardiographic monitoring, with supervision by a physician or other qualified healthcare professional. Use of echocardiographic contrast agent during stress echocardiography. Myocardial strain imaging using speckle tracking-derived assessment of myocardial mechanics. Transducers are placed on a patient's chest to record a two-dimensional echocardiograph, which uses ultrasound to visualize the heart's function, blood flow, valves, and chambers. In 93,350, the echocardiography is completed while the patient is at rest and exercising on a treadmill or stationary bicycle with or without medication and includes M-mode recording, when performed. Code 93351 also includes the performance of continuous electrocardiographic monitoring with supervision by the physician or other qualified healthcare professional. Code 93352 is assigned as an additional code to report the use of an echocardiographic contrast agent during the stress test and should not be reported more than once per stress echocardiogram. Echocardiography, Transesophageal, T, for guidance of a transcatheter intracardiac or great vessel, S, structural intervention, S, e.g. TAVR, transcatheter pulmonary valve replacement, mitral valve repair, paravalvular regurgitation repair, left atrial appendage occlusion/closure, ventricular septal defect closure, Perian intraprocedural, real-time image acquisition and documentation, guidance with quantitative measurements, probe manipulation, interpretation, and report, including diagnostic transesophageal echocardiography and when performed, administration of ultrasound contrast, Doppler, color flow, and 3D. The transducer sends sound waves to the heart and collects the echoes that bounce back. These echoes become high-quality moving pictures that show up on a computer screen. T provides high-quality, real-time images of the beating heart and mediastinal structures. This code reports the guidance during the procedure, S, as well as measurements of the surrounding structures. It includes probe navigation, image acquisition, and physician's interpretation and report. Diagnostic T is included in contrast administration, Doppler, color flow, and 3D images, when performed, are also included. Doppler echocardiography, pulsed wave, and/or continuous wave with spectral display, complete. Follow-up or limited study. Transducers are placed on a patient's chest to record a Doppler echocardiograph, which uses ultrasound to visualize blood flow velocity, direction, and type of flow in different locations in the heart. Doppler studies can be displayed on a strip chart or video recorder. Doppler echocardiography color flow velocity mapping. The technique for Doppler color flow velocity mapping is similar to that of other echocardiographs, with transducers being placed on the patient's chest to record cardiac activity. Color Doppler is two-dimensional Doppler in which the signal is encoded with color to more clearly identify flow direction.